Enhancing occupational therapy practice, improving outcome through evidence-based measures. Occupational therapists play a crucial role in improving patient care by addressing individual needs, the impact of health services on daily functioning, and ultimately enhancing health outcomes. Evidence-based outcome measures can showcase the effectiveness of occupational therapy services on providing quality care. The lack of standardised outcome measures in occupational therapy services hinders the ability to show evidence of service effectiveness. Thanks to the OT School of Victoria Clinical Award, with their support we are able to conduct our 4-phase research project aiming to enhance the use of evidence-based outcome measures in occupational therapy practice to demonstrate the value of occupational therapy. In this phase, current practice of occupational therapy services are identified. Using a co-design approach with occupational therapists, we identify practice-relevant domains and categories of the ICF to represent current practice areas. We conducted a systematic search of the literature to identify current outcome measures. We linked the content and the item responses of the identified outcome measures to the categories of the ICF, as well as evaluate the measurement properties of the identified measures using the Cosman criteria. We then match the categories of the ICF from those identified with clinicians to those identified from the systematic review to select appropriate outcome measures for the service. Phase 2. Select phase. This phase involves trialling the identified outcome measures from Phase 1 to understand the clinical utility and feasibility of the outcome measures from the perspective of the consumer and the therapist. The data is analysed to identify and select the most feasible and acceptable outcome measure for the organisation. In this phase, the selected outcome measure is implemented using knowledge translation strategies to ensure sustainable use of the outcome measure across the organisation. The 4th phase is the impact phase. In this phase, the outcome measure data is analysed to identify the value and impact of the service. Implementing evidence-based outcome measures in occupational therapy can lead to significant improvement in patient care and overall healthcare outcomes. Join us and contribute to positive change. Contact Tamara Tse to identify and learn more about how to get involved to make a difference in our occupational therapy practice. Contact Susan Darzins to explore opportunities and collaborations on this meaningful project.